course, leads directly into the brain. What is going on in brain chemistry that can promote OCD. And there is now evidence that there are certain areas of the brain, the caudate nucleus, which is very deep inside the brain, and the frontal lobes, which are involved in OCD behavior. And they can determine this from PET scans, imaging scans of the head, where they can demonstrate that OCD brains are very different from so-called normal brain function. So that there is a definite biochemistry involved in many cases. And that's why medication is often helpful. What are called serotonin reuptake inhibitors, which help to increase the level of serotonin in certain receptors in the brain, which then in turn seems to control this behavior. But an interesting sidelight on that is that one theorist came up with the notion that OCD behavior is similar to what happens in lower species and may involve an analogous part of the brain that exists in lower species, like birds who do nest building. And you know, a bird who starts building a nest will go back hundreds and hundreds of times collecting twigs until that nest is completed. And he's driven to do that. It's an instinctual kind of behavior. So the theory is that somehow that part of the brain is dysfunctional in a person who develops OCD, and they begin to act in a certain sense like that bird, collecting things, hoarding things, checking, being preoccupied with nothing but getting this one thing done, whatever that might be.
Only what's missing for the bird, they somehow have a cutoff spot.
Exactly.
And for OCD, we don't have an off button. Well, what, so I was going to ask you about anafranil.
Yes.
Now, I know a few years ago that was touted as the cure-all for OCD, and I'm wondering, as a specialist in this area, if that turned out to be true, or...
Okay, anafranil is a brand name for chlormipramine, and it was just approved for use in the United States about 5 years ago or so, 5 or 6 years ago. It has been proven very useful.
Okay.
For some people, it's almost an overnight improvement.
Wow.
Now, that doesn't necessarily mean that they're completely cured. Behavior therapy is often very important as a part of the total treatment method.
Okay.
It's not just drug therapy alone, because that tends to put a mask on the behavior, but if the person is withdrawn from the drug, the behavior often will resume.
Okay.
So that's why they need, most people need a combination of behavioral therapy and a medication. Some don't need medication at all. They can respond to the behavioral therapy alone. Some people don't want medication. That may be part of their problem.
Fear of poisoning or
Fear
something.
of taking something into their system that they don't want any part of. So even with those people, though, it is possible with the methods we have today through behavioral therapy to improve their situation.
Now, I'm sure you do, obviously, this behavioral therapy at your counseling center.
Exactly.
And you have some information people can receive from you if they write to you, I believe.
Exactly. This is a brochure that's put out by the National Institute of Mental Health.
There you go.
There. And I would be glad to send this brochure if anyone wants to send me a self-addressed stamped envelope. I'd be glad to send you a copy. Within this brochure is a self-screening test, which you can take and score yourself and get a pretty good idea of whether you have this problem.
Okay. And then I'm sure it says in there that if you do have that problem, you know, ways you can go seek help. Ideally, go and see you, since you're the person that seems to be the expert on this. But that's nice, the National Institute of Mental Health.
Yeah.
Okay. Well, I also wanted to ask you to define a couple terms for us. So let's take a look at the cognitive and motor behavior patterns, our next graphic for obsessive compulsion. Now, we talked about obsessions. These are thoughts. What does the word ruminate mean, rumination?
Well, rumination is a repeated thought pattern. Not necessarily repeated. All of us ruminate at at times when we have an issue or a problem and we go over and over different angles of the problem and so on. So rumination doesn't necessarily mean repeating the same thought over and over,
Okay.
but it's more of a definition of thoughtfulness, preoccupation with one's thoughts would be the general definition of rumination.
Okay, so someone's thinking about what I'm thinking about, like noticing that I'm thinking about this.
Yes.
Yeah.
Okay.
Okay.
That would be.
Would that be
I
a
guess
differentiating?
It could be if it takes a fair amount of time.
Okay.
If you get really involved in it and other things kind of fade out,
Okay.
that would be typical of someone who's in a ruminative state. Is
Okay.
that other things sort of fade and they're really focused on that thought.
Okay.
Pattern.
What I noticed when I was watching this 48 Hours episode was when somebody is in that place, it is very hard to break their concentration. I mean, I noticed with the woman who washed her hands, the reporter later in that segment tried a couple different times to engage her while doing that, and she wasn't able to shift her focus. I mean, she
Right.
needed to keep doing this and keep talking about that. I mean,
Yeah, it's almost like a trance state that people go
Okay.
into when they are doing their rituals.
Okay.
That they're, in fact, if they are interrupted and they lose track of what they've been doing, they have to start over again frequently,
Okay.
which is very frustrating. You know, if you have to count something 50 times and you're up to 48 and you lose track and you have to start over at 1 again. Like, for example, I had a client who needed to, when she put her linens into the closet and she would take a towel out, she always had to count down a certain number from the top of the pile and take that towel out. And if she lost count or lost track of how they were piled up, it was extremely upsetting to her.
Okay.
So this is the way this can get a hold of people.
Well, what I would imagine that like a lot of mental disorders, this particular disorder can also be progressive. So, I mean, is that true that maybe somebody starts out counting 5 times, but then they increase it to 10 or 20?
That's right.
Okay.
That's very true. And very often it starts in childhood. About a third of all sufferers from this condition start in sometimes very early childhood.
Okay.
You can see the precursors. Now, the focus may change as they grow older,
Right.
but this can last for a lifetime unless the person gets the right treatment.
Okay. So, in terms of being able to identify it in ourselves and seek help, maybe one particular point of reference might be the people who live with us. Because I can imagine that this ritual behavior would become so normal for me that I might not even recognize at some level that it's gotten worse.
Well, that's
Is that true?
That's true. And in some families you find other families members who are enablers.
Ah, okay.
In a similar fashion you might find an enabler for an alcoholic. In other words, they do the things the person doesn't have time to do. They give a lot of reassurance. They try to give reassurance, which is usually doesn't last very long.
Okay.
So you have that style of family interaction, which tends to keep the pattern going. And then you have the people who get angry and frustrated with the sufferer.
Right.
And this doesn't help either, because that increases the level of stress. And we know that the more stress, more anxiety generally that the person is suffering, the more these patterns tend to expand.
Well, and that's so, that's so true for all of us. The more stress we get, the more we tend to repeat ourselves. Let's take a quick look at our final graphic, which I took from the recent article in the Mercury News. And what this is a checklist, sort of comparing compulsive and not compulsive behavior, sort of differentiating between something that might be a disorder versus maybe something not. For example, hand washing. Someone who washes constantly throughout the day versus someone who washes their hands before every meal, like our mothers taught us to do. Someone who checks and rechecks the locks for at least 30 minutes before leaving versus somebody who sort of goes and checks the locks at night before bed. That sort of comparison. So it seems like, and that was something that someone asked me before the show, that, hey, does it mean I have obsessive compulsive disorder because I like to collect things, and that, well, not particularly. And I'm glad you started at the beginning saying we have a difference in personality style versus an actual disorder.
Yes, and in our society, a certain amount of compulsivity of a healthy nature is very desirable. You know, those are the people who advance in their jobs. Those are the people who make an impression on their friends because they're willing to think about, you know, how can I please that person, and so on. So the kinds of people who have this in a normal degree are doing fine. It's like with every psychological symptom. The symptom pattern that creates a problem is really an exaggeration of something that we all experience at some times or another in our lives, like anxiety. We all have normal anxiety. And at times, with people who develop an anxiety disorder, it becomes excessive and it becomes threatening to their ability to conduct their lives the way they want.
And causes, again, begins to, like you said, interfere with level of functioning and satisfaction with life. Well, Dr. Schoberg, we're going to need to close. I want to thank you for making the time to come down tonight. I want to thank you for joining us. Do tune in the next few weeks as we talk about adult children of alcoholics and infertility. I'm Mary Crocker Cook. Good night.